Dr. Nick Gates. I'm an orthopedic foot and ankle specialist with Commonwealth Orthopedic Centers. We're going to talk about a condition I treat frequently called chronic ankle instability. A patient with chronic ankle instability typically comes to me with one of two complaints. They might talk about intermittent or chronic ankle pain that bothers them with certain activities or sometimes just on a daily basis, or they may also complain of frequent giving way or frequent ankle sprains. Both of those types of patients are sometimes suffering from what we call chronic ankle instability. This happens after multiple ankle sprains, some severe or even multiple more minor ankle sprains, where the ligaments of the ankle end up becoming a little bit more loose than they should be. This can lead to chronic pain, particularly with activities, even sometimes just going up and down steps. And this can also lead to chronic repetitive ankle sprains, particularly in the athlete population. What we do with those patients is do our best to try to get their symptoms to resolve and get their pain to resolve with non-surgical management. For the most part, that amounts to a good functional ankle brace to use with activities, particularly in our athletes, and also physical therapy for neuromuscular and strengthening control. If we have patients who can participate in a physical therapy program and rehab program, especially those with more minor instability symptoms, a lot of times they can resolve their symptoms without anything invasive. For those patients who go on to continue to suffer ankle sprains despite attempts at rehab and physical therapy, they become candidates for a procedure called lateral ligament reconstruction of the ankle. Recently, I've adapted this procedure with some advances that include a technique called an internal brace. An internal brace accomplishes the same thing that an ankle brace you might put on your athlete around the ankle. However, this is a small device we're going to insert in the ankle as part of a procedure. The short summary of that procedure is we're going to take those loose ankle ligaments, we're going to imbricate or tighten those ligaments so that it's no longer loose and the ankle stays in its socket better. This can control pain, and this also greatly diminishes the risk of having another ankle sprain, including those athletes who return to sport. The advancement in the internal brace has been in addition to a procedure that we already do, and the insertion of this internal brace improves the stability significantly enough that we've now advanced our rehab to an earlier process. Patients are going into physical therapy earlier, they're regaining their strength and their comfort earlier, and we're seeing athletes return to the sports. We're seeing weekend warriors return to their activities, and we're seeing people return to their daily lives faster than they did in the past. If you have chronic ankle symptoms, either pain or chronic giving way, even those patients who between their sprains are not having much pain, but they continue to sprain their ankle, this is a good procedure to consider.